All right, so hello everyone. Thanks all for coming to the GLO seminar. My name is Jun Hyung Kim. You can call me Jun. And I'll be talking about the mental health consequences of working from home during this COVID pandemic. This is joint work with Professor Jin Sung Park, who was formerly my colleague at Jinan University. Now he's in Korea at Dong University, and Yu Young-ho, who's a PhD student at Columbia. I think she'll be in the market soon, not this year. So I'm currently at Jinan University in Guangzhou, China. So, all right, let's start. Okay, so working from home. So working from home has been around the world. About a quarter to a half of workers around the world has been working from home, and that's for the pandemic. But the proportion has, during the pandemic, the proportion has increased greatly from before the pandemic, and it is expected to be a sort of new normal that is likely to persist even after the end of the COVID-19. Now, because it is likely to persist, it'll be useful to try and design what an optimal work arrangement, how to think of this working from home as a work arrangement. So on the one hand, it can be a way to save the cost for the firms. It will reduce this cost associated with office space. It can reduce monitoring costs, but also from the worker's side, it reduces cost of commuting, it saves time in commuting, and allows workers to be flexible in terms of domestic duties, childcare, and so on. But also, especially from workers' side, it reduces face-to-face interaction with colleagues that could reduce productivity and also can get workers feel lonely. And also, by spending more time at home, it can increase the chance of work-life conflict. Now, what is this paper trying to achieve? We are trying to show you evidence of the effects of working from home on mental health using evidence from South Korea. To do this, we collected a real-time survey of 2,000 individuals in the June of 2020, and we estimated using two different matching methods. In short, we found that the working from home during the COVID-19 pandemic has a negative effect on self-reported measures of mental health. We also found some heterogeneity and consistent with a lot of literature on COVID, we found the effects were greater for women. Somewhat uniquely, we found even more negative effects on those who were primarily responsible for housework. Surprisingly, we found little negative effects for those who said they were with children at home, meaning the negative effects were concentrated on those who were not with children at home, and we'll try to interpret what this might mean about the nature of working from home. As a little bit of literature review, so there was some work on working from home before COVID. The most famous one is the 2015 paper on QJD. That paper actually did an experiment on a company called Ctrip. Now it's a trip.com. They allowed some workers, experimentally allowed some workers to work from home and not others. In that particular arrangement, they actually found that work from home generally had a positive effect on worker productivity and worker mental health, perhaps in part because it was partly a voluntary choice of take-up. They also found out that workers were not able to anticipate whether they would end up enjoying working from home. So after the mandatory period ended, they found that a lot of workers actually switched sides. Many of those who were working from home during the study period chose to return to office, and many of the others who were at the office decided to start working from home. There are some other studies too, famous one, Dingwei and Neyman, that showed that there are many key differences within and across countries with respect to the types of jobs and job characteristics. that where it is possible to work from home or not. In particular, jobs that tends to be high skilled and low paid were associated with being able to work from home within countries, across industries, and also across countries. So the anticipation is that the COVID could increase income inequality because by the possibility to work from home. And because of the structural change in industry and other factors, the anticipation was that work from home is likely to persist even in the future. And there are some studies about the effect of COVID-19 on mental health as well, mostly finding negative effects stronger for women and those from low socioeconomic status. Our key contributions is that we believe we are one of the few papers that looked at the effects of working from home. Mental health is an interesting measure by itself. It is also closely associated with worker productivity. We also present evidence from South Korea where they did impose some encouraged social distancing, but no forceful lockdowns. So it could be a useful case study for future pandemics that is somewhat less severe. And we also focused on the role of family environment, a person's role in domestic production, and the presence of children suggests that the working from home experience depends heavily on family environment, and future employers and policymakers thinking about workplace arrangement should consider these factors when they adopt policies related to working from home. Okay, so first I'm going to briefly go over the background of COVID-19 in South Korea. So COVID emerged relatively early in Korea. First case detected in the January of 2020. Initially it was under control, but it increased quickly from February, and by June 2020, the number of cases was quite high compared to other countries. Also, it was assisted by mass outbreak in Daegu metropolitan area and also in the capital region, Seoul region. For capital region, there were so many people, very densely populated. Daegu area, there was a mass outbreak related to a religious sect. So this is some geographic distribution. So this is the capital Seoul area, and this small proportion is the Daegu metropolitan area associated with the religious sect. So this place is a little heavy, but most of the Korean population is concentrated in this area. So government response was there was no forceful lockdown in Korea, but government heavily campaigned social distancing. They also did a wide-scale test, and they also traced individual movement of those found to have of the COVID patients and those found to have been in close contact with the patients. So also during this time, the government did a daily update of COVID cases and publicized locations where the confirmed patients visited during the past 2 weeks. And there are studies showing that people actually actively avoided those places. And also all these events and mass gathering places were all closed during this time. Schools also closed during the peak time. And by June, some schools started to reopen slowly, but they soon found COVID spreading in the schools as well. So the school opening was often delayed. Working from home was also encouraged. Some employers adopted it, but not all of them. So I'm going to go deeper about this soon. Korean workplaces is well known for having long hours and schedule very inflexible. Before the current COVID, I looked at the statistics, and only 3 to 4% reported having worked from home at least once a week. So before, or even a month. So before today, Korea was not a place associated with heavy working from home, and most of the workers did not have any experience on working from home. Now, where did I get the data? So the data is collected by a professional survey firm, initially associated with usually a marketing firm that rents out their panels. So I designed a survey with one of my co-authors and contracted this firm to do a survey of 2,000 individuals during 1 week in June. So I focused on heads of households or the spouses aged between 25 and 55 because I wanted to focus on those who are working and who are likely to be the breadwinner of the family. And I tried to be geographically represented by sampling from all parts of the country. I also was interested in, I included remote work, working from home experience and mental health measures. And I was interested in the family environment, so I included questions about who's doing the housework, who's the main person doing the housework, or the family, what's their conflict with the family, and so forth. Mental health measures, Kessler's 6-item scale. So we wanted to make the surveys as quick, as short as possible to reduce item non-response. So we picked a relatively short one, nonetheless quite popular in both psychology and economics. So it's basically based on 6 questions, answering in Likert scale 1 through 5. Do you feel anxious? Do you feel lethargic, tired, and so forth? And we construct some score out of this. Simple characteristics of work: those who worked from home at any time during the study period, and those who never worked from home between basically January and June. Basically, it confirms with our expectations. Years of education higher for those who are working from home, who had experience working from home. Income also somewhat higher, more likely to be from public sector jobs because the government heavily enforced this. Also, working from home, the employer size tends to be slightly larger because government campaigned harder in something semi-enforced larger employers to allow working from home. Also, those who are living in big cities were more likely to working from home, possibly because of the industry composition. So some score, so higher number means worse mental health. So it's a rough idea of what's going on. So it does seem that those who are working from home have slightly worse mental health. If you look at each of the subscales, also these pattern is observed worse mental health for working from home, even within some of the subscales. Empirical strategy. Now, what we have is observational data, and the choice to work from home is likely to be at least partly endogenous. So, and the instruments we considered, such as the outbreak related to the religious sect and other factors, turned out to be not good enough as a saying to be used for instrumental strategy. So we decided to basically compare one group to another using matching strategy. So using a basic matching framework, say D equals 1 for those who work from home and 0 otherwise, and for the counterfactual outcomes Y1 and Y0, if you look at the treatment of the treated, simple comparison will give us selection bias based on the counterfactual status when they didn't work from home. So this selection bias will disappear if there is no selection on metals. There could be also, although we didn't represent it here, there could be also selection on gains if people could anticipate the benefit from working from home. This could be true that if we take the lessons from the Bloom paper, QJ paper at face value, it may have been difficult for workers to anticipate the gains from working from home because so few of them had prior experience. So the key is this: what direction would it be? What the bias would look like? So identifying assumptions, identifying assumption is that that bias term is not there. There's a mean independence. These are technical assumptions. Propensity score is large enough, and there's a stable unit treatment of value assumption, no peer similarity. We impose this because that's the only way to proceed forward, but maybe this is something we can check in the future. So the key interest is the first assumption, no selection on levels. Is that true? Well, we're using matching, so we only control for observables. But we argue that based on Korean setting, the observable characteristics is likely to play an important role in the determination of DI, the treatment status. First, we know from other literature that working from the occupational and industrial characteristics play a very important role in whether working from home is possible or not. IT workers, teachers like us, or legal professionals, or even some, say, entertainers, they can all work from home. Entertainers because they have YouTube. But cleaners, construction workers, they cannot. Also, the working from home availability was heavily influenced by government policies. And in some cases, in case of Korea, for government jobs and very large employers, working from home was mandated. Also, here in case of South Korea, there is very little working from home practiced before COVID. So I think that likely means that people could anticipate their gains. And based on anecdotal evidence I read from the local newspapers, it seems they're working from take-up. Take-up was mostly driven by whatever it is available by employers, and stigma didn't seem to be an issue. It was actually discussed in some of the newspaper articles. They were surprised that workers didn't really mind about the stigma of not showing up to work. There were workers who were worried about the productivity cost. Now, if mentally healthy workers self-selected into working from home because they anticipated they were strong enough to work from home, then our estimates are likely to be biased upward positively. And in that case, our estimates of the damage of working from home would be lower bound estimates. Now, the selection is such that the unhealthy depressed workers were chosen to work from home, then our estimates are biased downward and our negative effects are exaggerated. This would be the case if working from home was enforced primarily, for instance, in high-intensity pandemic areas, and there was a direct effect from the COVID to the workers. So we're not sure. In principle, we're not sure which is more serious, but this issue was primarily the biggest issue mostly in that Daegu area, and our estimates mostly remains robust even if we exclude that area. So we believe that this case is more likely. I'll have to speed up. So we use two different matching methods, primarily based on propensity score method. One's kernel matching, so we use kernel matching based on propensity score. The other is inverse probability with regression adjustment proposed by Woodridge that are known to be a little more robust to model sophistication. So this is some evidence that it does succeed in matching based on observables. Another benefit of matching is that it relaxes the Euler's constraint of imposing linear restriction, which could be an issue if we have to extrapolate on the regions not covered by propensity score. But it seems that it covers most of the support. So results. First, who are working from home? Some descriptive statistics. So gender, education, family type. Education seems to play an important role predicting work from home status. Family type, not so much. So if people are trying to act on the potential gains, then we might think that those who are married and with children were much more likely to choose to work from home, but that doesn't seem to be the story here. It's more about education, earnings, firm size, and firm type. which all suggest that it was more about availability, technical possibility, rather than selection on gain. So in this limited set of variables, what jobs can be done from home? Always looking at it seems that it's also driven by types of industry, telecommunication, public administration, education, leisure. It's a little strange, but I think this is more about the CQs, not manufacturing and not sales. We've seen this before. So also this is trying to show that it's all about this education and the job characteristics. In terms of location, it's just Daegu region. The baseline is Seoul, so it's really just to Seoul and Daegu region. Seoul is such a huge area; it covers so many people. So only Daegu region, this is unique. But our results will stay robust to excluding this area. So this is the baseline. I don't have much time, so I'll try to speed up. So positive effect means worse. Negative means that the working from home had negative effects on mental health. This is a composite score in units of standard deviation, about 0.1. Looking at the subscales, we see that the effects are not strong on measures such as anxiety and restlessness, but more on lethargy, being tired, sad, and worthless, which seems to paint a picture where workers were feeling lonely and tired and sad, not very anxious and worried about, for instance, pandemic, trying to survive the pandemic. It seems to be being tired and feeling lonely, for instance. Now, separating by gender, the effects are much more stronger and more significant for women and not on men. This is familiar result from other studies. But if we look at by housework responsibility, the question is who was the main person doing the housework during the pandemic period, and this is separating those who said I'm the main person responsible to those who didn't say that. The effects are actually bigger, 0.2, to those who said they were doing most of the housework, and here the effects are almost none. So it seems that just helping housework isn't enough. If you're the main person planning all this, then you're feeling really stressed out. Now, this is the presence of children. The difference is a little less stark, but surprisingly, those who didn't have children younger than 18 living with them at home, they were feeling the negative effects of working from home, especially in lethargy, tired, sad. But those who said they were with children, not much effect. So this was the one result that caught us by surprise. We anticipated that all this additional responsibility of taking care of children would impose additional mental burden, but it seems that perhaps the utility payoff of being with your children were able to offset the loneliness from working from home. We additionally tried to control for labor market, possible role from labor market shocks to give available information. We were not able to do that very well. The only way to do it is by controlling for labor market outcomes. But that could mean that we're controlling for outcomes and making a bad regression. But nonetheless, we tried to do it. It reduced our effects somewhat, but our results mostly stinks. So, in conclusion, what we find, seems that working from home during the pandemic had negative effects on the mental health of workers. It concentrated on women and those who are doing a lot of housework and those who are not living with children. And we interpret that as a potential evidence of family-work interaction. And because workers may feel lonely, it is important to account for the effects of working from home on workers' mental health and productivity through this particular channel, which is likely to be relevant in the near future because of the extended pandemic. And given the selection issues, we are cautious to interpret our results as strictly causal, but given the unique institutional setting in South Korea, we're inclined to interpret our results as lower bound estimates.
Thank you very much.
That is all I prepared.
Thank you very much.